Welcome to the Immune Edit. I'm Dr. Doug Jones. If your immune system feels like the enemy, or you're just tired of not feeling like yourself, this space is for you. Your child eats some rice. Initially, nothing happens. Then, about 1 to 4 hours later, relentless vomiting. Oh my gosh, the vomiting. Relentless. Your child then becomes pale. You're kind of getting a little nervous, a little anxious because they're pale. Now they become lethargic. But there's no hives, there's no wheezing. Kind of choose to ride it out. But they're pretty lethargic and it's pretty scary. What's going on? Take them into the pediatrician. Yeah, they're like, maybe it's a GI bug. Maybe. Food poisoning? Maybe. They get some allergy tests done. Why not? Every symptom that occurs, let's get some allergy tests done. But guess what? The allergy tests are normal. So they're like, hey, it's probably a GI bug, probably something. Just give them rice again. So you give them rice again. And guess what happens? The vomiting over and over and over again. They're pale again. You're scared again. You're fearful again. They're lethargic again. What is going on? That was reproducible. So is it a food allergy? I mean, the allergy tests were negative. Is it? Guess what? It is. It is a food allergy. This is the food allergy that didn't read the textbooks. This is the food allergy that doesn't bang down the door initially. It doesn't RSVP, to the party. Rather, it shows up late. But then, when it does show up, it flips the effing tables on you. The effing FPIES table is what it flips. This is something called FPIES. Have you heard of it? It stands for Food Protein Induced Enterocolitis Syndrome. That is an effing mouthful, which is why we just call it FPIES. And we're just going to refer to it as that from now on. We're going to stick to that. This is a specific kind of legitimate food allergy that I'm going to talk about today. But interestingly, it's also helping me understand another subset of patients that I treat and have talked about, patients with long COVID or long vax symptoms, or mast cell activation syndrome in particular. So, not that I'm equating the two, but what I'm telling you is this particular disease state has helped me understand others a little bit better. And I'm going to get into that later. So, stay tuned in how these two have some similarities to them. And I think as we look at both groups, we may be able to understand them a little bit better. So what is FPIES and what is it not? So interestingly, when we talk about traditional food allergies, the ones that get the press, it's called an IgE-mediated food allergy. That's a protein that's made against a specific food. It typically causes a release of histamine and tryptase and all kinds of chemicals from the body that leads to anaphylaxis. That is not FPIES. Okay, so is it an allergy? Yes. Resounding. Yes, it is an allergy. Now, it may be a non-IgE-mediated food allergy, which means it doesn't go through the traditional pathway, but it's still an allergy. Well, what happens here is symptoms will typically occur about 1 to 4 hours after you ingest the food, since it's not mediated by IgE. So you have a more delayed reaction. This is one where there isn't any kind of diagnostic biomarker yet, meaning there's not like a great test. Now, there's a whole host of biomarkers that have been described in FPIES, but right now it's kind of more looking at different patterns and correlating strongly with their clinical history. Ultimately, this is a clinical diagnosis, meaning there's not a specific test that's going to do it. It means your clinician needs to know what the hell they're doing, and they need to understand kind of the history of this, correlating the symptoms and the history and all the things, and they're able to make the diagnosis that way. There are tests that we can look at to get some clues and some insights. but there's no single test or biomarker currently. In real estate, as I mentioned in some podcasts, we often talk about what's important: location, location, location. Well, in this particular one, like most other food allergies, I can't emphasize this enough. It is history, history, history. We have to actually listen to a patient. We don't necessarily need more tests, we need the conversation. And even though there's not a single test, it doesn't discount the condition. Okay, let's not discount this. Let's not put this off as, oh, that's kind of like the other thing. No, it's not that. This is very potentially life-threatening. It's just occurring in a different way. Not everything is histamine related, despite what your supplement pushing influencers say. Okay? It's not that. FPIES is complex, and it's integrated signaling between the gut, the nervous system, and our immune system. The actual pathophysiology, and when I say pathophysiology, that's kind of the scientific term for what your basic influencers call root cause. That's kind of what I'm referencing. The pathophysiology of FPIES is not completely understood. But I think there's been some incredible research done to give us insights that help us understand the gut, this bidirectional communication that happens with the nervous system and the immune system, particularly within the gut. And by the way, this is why I'm getting insights into long COVID and long vax patients, is the understanding that we're gaining from that microbiome or the gut health, in addition to what that neuroimmune signaling that's taking place within FPIES. So it's complex. Testing can be a challenge. And FPIES can often masquerade as a GI bug, viral gastroenteritis. It can masquerade as sepsis, or what we call a surgical belly. It often requires repeated ER visits before anyone even connects it to a food. And sometimes it's not connected to the food because of the delay in the reaction, which kind of confounds it. Families will often report a revolving door of specialists and unnecessary testing before they get their diagnosis. What we once thought of as just a pediatric diagnosis are actually more adults that likely have it than children. So it is not just a kid's diagnosis. We have to look across children, adolescents, adults, all age groups now. We have to have our radar high for this. And we've seen a couple of shifts also with this, because if you'll recall, in the, I'll call it the traditional food allergy world, we have this big push for early introduction of foods. Oh, you'll hear it. All the allergists, the influencers, everyone's like early introduction, early introduction, early introduction to prevent IgE-mediated food allergy, meaning what we've, for to give you a little clinical context, okay? What we looked at for decades upon decades was the initial thing that pediatricians and allergists said was delay the introduction of certain foods like milk, eggs, wheat, peanut, etc. We found that to be wrong. In 2015, there was a landmark study that was published that said early introduction, not delay, but early introduction of these foods could help prevent IgE-mediated food allergies to things like peanuts, milk, eggs, wheat, etc. What they didn't talk about, and what we didn't realize at the time, was what would that early introduction of foods do for FPIES children? Well, it actually may not be so helpful in those children, because we're seeing a little uptake in peanut FPIES, for instance. So we have to be pretty careful in what we're recommending there. And when we're recommending early introduction of foods, I'm going to emphasize that's for IgE mediated, not non-IgE mediated food allergies. Um, there, so there's challenges with this. There's also, because there's not a biomarker, because we don't have a great test for this, it takes a lot of extra work. And sometimes there's some provider reluctance to put in that extra work. Food challenges may be the gold standard in terms of getting a diagnosis, but food challenges are very time consuming. They are risky. They're not ideal. They are both anxiety provoking for both the family and the patient and the provider, mind you, because the reactions can be severe and they are delayed. So it's kind of this anxiety provoking thing for everyone. So there's some reluctance and some hesitancy to do them. So we have to really pick our battles and pick our spots in terms of when we do the food challenges. Everyone's got to be on the same page with those things because nearly 20%, 15-20% can experience shock, hypovolemic shock uh, from food ingestion, from the offending foods. That's nothing to be, that's nothing to take for granted. So this is something that is serious, is potentially life-threatening, can be difficult to diagnose, can be difficult. But for the sake of the families, we as clinicians have to step up our game. We have to have more recognition of this group. We have to provide more support for this group. We have to be more willing to work with these families and really get an accurate diagnosis and then proceed with management efforts. Families don't need your vibes. Like, I get so sick of that. Oh, I'm sending vibes, whatever. They don't need your vibes. What they need is a diagnosis. They need a plan. They need to be heard. They need to be validated. And they need an ER letter, you know? I'm going to give a shout out to a nonprofit organization called International FPIES Association. Probably one of the better run nonprofit organizations, I think, in existence. Um, there's a couple that I'm a big fan of. Uh, because of this particular topic, I'll give a shout out to them because I think they provide incredible information for families as patient advocates. They are science driven. There is tremendous information on their website. It's called fpies.org in terms of practical information, practical resources that you as a parent can have for you and your children, that doctors can have in terms of how to even conduct food challenge in these patients. But one of the things that they provide is a pediatric emergency letter where it includes guidance. Like if you have this diagnosis and you have to present to an ER and you have this question of how am I going to even can communicate this to the ER, it provides a letter and it gives like appropriate therapy, guidelines and recommendations. Um, they even recommend prepping an ER to go bag, which I think is incredible. So check out their website, check out their resources, and I think it's incredible resource for patients and for clinicians. You can also see like what clinical trials are underway. So that's kind of a side note, but just a brief shout out to that organization because they work tremendously hard and they advocate for their patients in a very appropriate way. Not political driven, not, bureaucracy driven. It is driven by science, it is driven by passion, and it is driven just to help advance this world. And, I've been really impressed with the work that they're doing. I mean, the, part of this is there is a tremendous emotional load that families can feel because, first of all, It's not the typical allergy. They get all the press, they get all the publicity. This group doesn't so much, but yet it is still unpredictable. It is still potentially life threatening. They still have to alter every aspect of their life, but yet, they don't have some of the things that the traditional allergy families have. And so when your kid is crashing and you're just told, for instance, it's just a virus, that's not reassurance. That's what contributes to trauma. Being unheard, being dismissed just fuels the mistrust and fractures care relationships. So I think it's important that we have trusted resources out there for families that may be struggling with this. Sometimes parents are even trying to manage severe reactions at home because they've lost faith in ERs. They've lost faith in the medical system, the medical community, because they haven't been heard. Um, and eating just becomes this incredible stress for the entire family. So, with FPIES, it's not IgE mediated. It is inflammatory. It is this combination of the nervous system, the gut, the immune system. There's not a diagnostic, biomarker test for it. So there's challenges there. In addition to that, there are all different types of FPIES. There's not just one kind. Currently, according to the latest guidelines that I read, there's 4 types, where you're looking at age of onset, severity, timing and duration of symptoms, and also, ironically, whether IgE is positive or not. Yes, I know I've made a big case about where this is non-IgE mediated, but in some cases, what we call atypical FPIES, you can also have IgE positive. What is that? Well, if you have FPIES, let's say to a certain food, and you've been avoiding that, guess what? You're at risk of developing sensitivity from an IgE mediated standpoint. And those patients tend to have longer courses of FPIES. So that's kind of a subset in and of itself. I'm actually dealing with a case right now in my own clinic of this particular thing. So, common triggers with FPIES: grains, rice, milk, eggs, fruits, and veggies. So, it's a little different mix than what we think of with like your typical allergies. Seafood also can occur with adults, or commonly in adults. So, what do we do? You've kind of gone through this whole thing. How do we manage this? Where do we start? Where? Your head at times can be spinning with this on where do I even start? Maybe start by going to fpies.org. I think that's a really good place to start, is getting an advocate, getting some good information and good resources out there. But really what we talk about in terms of management, I think diet, diet, nutrition support, preparing for emergency and planning, and then we have to reassess for tolerance is kind of the threefold management approach that I think of. Um, Actually, I'm going to add one more to that. There's going to be a fourfold. So we have diet, nutrition support, preparation with emergency planning, reassessment for tolerance, but all along the way, I think you need emotional support as well. The emotional aspect is huge. So let's get into each one of these briefly. Diet. What I would suggest here is get a registered dietitian on board. These are fantastic professionals. Registered dietitians are your friend. They can assess calorie needs. They can get all kinds of creative ways that you can get nutrition and calories to your child. And I would say counsel with your doctor and that registered dietitian about your appropriate diet and also avoidance of offending foods. What I found is this isn't necessarily a blanket cookie cutter, one size fits all diet. No, it's the diet that fits the one. That's what we need to talk about. This needs to be individualized. Uh, and again, there is not one diet that fits all, but it's going to be the diet that fits the one, meaning you or your child. Work with your doctor, work with your registered dietitian to get the diet that fits you and the nutrition that fits you. Be aware of these supplement placebo stores that are going to try and, fix all your gut in one thing. Get people who are trained and qualified. That's what I would say on the diet, and it has to be individualized. Next, you want to prepare for the emergency. Be prepared, not scared. Emergency treatment is different for FPIES than your typical allergy because it's not running through the IgE pathway. It's different. It's through that gut neuroinflammation that we're talking about. And so it's a different mechanism. So for your emergency treatment, you have to address this again with your doctor, but it's going to center on hydration or rehydration, on Dancitron. Steroids may be considered. Again, speak with your doctor about that. And then you want to have emergency plans in place, whether it's a form, whether it's a letter, whether it's something, so that you can educate people, because some people aren't going to know. They're not going to understand. And so I think part of your emergency preparedness is having some documentation in hand. Again, that's where IFPIES helps you. Next is going to be emotional support for families. This is unpredictable. It's potentially life-threatening. It affects every aspect of life. There is a significant emotional load. I mean, you are navigating daycare, school camps, travel, parties, holidays, every meal, all the time. What do we do? That's a burden. That's a load. And so get some help. You're not in this alone. Get some professional help, whether it's a support system, whether it's a counselor, whether it's with your doctor or a nurse or whoever. Get some help, not only for your child's emotional needs but your whole family. Make sure that emotional support is there. And the next you want to get with finally is assessing that tolerability. The tolerability meaning, at some point, are you able to tolerate the food, or is your child able to tolerate the food? So you have to get with a doc that is competent, that knows what they're doing, that understands how to do food challenges specifically for FPIES children or FPIES patients, because food challenges for FPIES patients is not the same as a food challenge for your typical food allergy patient. So you have to ask the doctor, are they not only competent and qualified to do a food challenge for food allergy, but specifically for FPIES? It's different. Takes, more time, takes different emergency treatment measures, as we mentioned before. And you have to be able to have the infrastructure in place to be able to do those challenges. So that's one thing that you have to ask your doc, is if you have it, are they qualified and competent to do those things? Lastly, I want to move into some emerging topics. What's next? What is next in this world? I think we need to gain a much better understanding of that pathophysiology. Again, that's that scientific term for the influencer clickbait term, root cause. We have to understand, what the mechanisms are involved in FPIES. We can't really design fantastic treatments until we understand that piece better. We need to highlight that neuroimmunophysiology, whether it's dysautonomia or what patients' immune signatures are, what their microbiome looks like. For instance, we have to know how this interaction is occurring between the nervous system and the immune system and the gut. What players are involved? What are their roles? What puts people at risk? Can we prevent this? From this, what are then some of the more effective management modalities that we could use? FPIES isn't just a gut thing, by the way. It's not just a stomach thing. It's like the gut hits the panic button and then the whole body joins the group chat. That's what FPIES is. It's because a lot of people will think, oh, it's just within the GI system. No, 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 no. That's just where the panic buttons hit. But then the rest of the body gets into that group chat. I think in terms of the emerging topics and things that I've seen in the literature, we need to have a better understanding of our microbiome. The microbiome is that collection of bacteria or yeast or microorganisms that are within the gut and the balance of those things. Understanding the gut dysbiosis that precedes FPIES, but also that persists in FPIES. And how could we change that, for instance? How could we alter that or improve that so that we could hopefully induce tolerance to those foods? I think that's a really important key that we have to understand. Microbiome is a serious research frontier. It is not just a licensed for some randomized gut healing protocol. It's not some license to just promote some, all-encompassing proprietary blend of nonsense, placebo supplement to fix the gut. Okay, this is something that needs to be taken seriously and really looked at. And that microbiome and understanding that effect and how it affects the nervous system and the immune system in concert. The other thing that I would look at in terms of emerging therapies is there a potential role for biologic medications, such as dupilumab? I'm not promoting dupilumab for this right now. I think more research needs to be done. I think we have to have a greater understanding of the endotypes of FPIES and define that a little bit more so that we can understand the role of biologics. Once we understand some of these endotypes better, then I think we're going to understand the role of the biologics better. But just in closing, FPIES reminds us of something that medicine really struggles with. Not all immune diseases announce themselves loudly. Some whisper, some wait, some hide behind normal labs and delayed symptoms. And when medicine only listens for hives, wheezing, or numbers on a chart, it misses the patients whose suffering doesn't follow the script. FPIES isn't rare to the families living it. It isn't mild because it's delayed. And it isn't less real because tests come back normal. It is real. It's neuroimmune mediated. And it can be life altering. It can be life threatening. For decades, our message to these families was simple and painfully insufficient. Avoid the food, wait it out, hope time fixes it. But hope without understanding and a plan isn't medicine. Today, we're finally beginning to see what FPIES actually is. It's a neuroimmune disorder of the gut. It's entangled with that nervous system. It's influenced by early immune development, microbiome signaling, and inflammatory pathways that we're only beginning to map. That's not speculation. That's where the science is pointing. And here's the most important part. Understanding doesn't just create treatments, it restores trust. A trust that was lost in the beginning from a lot of FPIES parents, a lot of FPIES patients, because they weren't heard. When families are believed, fear decreases. When patterns are recognized, chaos becomes explainable. And when clinicians stop saying tests are normal and start asking, what's your story? What's your history? That's when healing really begins. So I'd say to clinicians, just stop dismissing. Stop saying, well, your tests are just normal. Start understanding, start listening, start asking, what's your trauma? Where does your story begin? Because science doesn't move forward by dismissing what we don't yet understand. It moves forward by listening, especially to the patients who are right before the science caught up. So, what are some edits that we can make for today? Some of the edits that we can make for today are: there is a food allergy with no hives, and it can still be severe. If your child vomits 4 hours after a food and everyone says it's a stomach bug, listen up. Normal allergy tests don't undiagnose a food allergy. We always have to have a diagnosis with a history. And the last thing is, epinephrine isn't the answer for this particular patient group. Maybe the last thing is, let's take a look at that microbiome science as it's promising. Let's pay attention to what we're doing. Let's work together. Let's look at some resources. And let's listen to these patient groups that may not have had the press through the years. Nonetheless, they're a growing group. Their voice in the science is getting louder, and it's awesome to see. And I'm going to be one of their biggest cheerleaders. And, I've assessed many FPIES patients, and it's exciting to see what's on the horizon. So if you have further questions, please tune in, comment, let us know. We're happy to help. Tune in next time for the Immune Edit. Thank you so much again for tuning in. We'll see you next time on the Immune Edit. This show is separate from my clinical practice at Global Allergy Immune Network. This show represents my opinions and my guests' opinions. Neither myself nor the show endorses the views or statements of my guests. This show is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional. This show is provided with the understanding that it does not constitute medical or other professional advice or services. If you're looking for help in your journey, please seek out a qualified medical practitioner. It's important to have someone in your corner who is a trained and licensed healthcare practitioner who can help you make changes, especially when it comes to your health.